Hello everyone, it's Dr. Andy Toy here from Keep Calm and Carry On Aligning. And today I'd like to talk to you about why I created the TCO Blueprint training program. Well, my first TCO was in 1986, and I know that since then, working with a TCO has added so much value to my patients, so much value to my professional life, and has really helped me along delivering the best possible patient journey that I could ever deliver. Why is this? Well, I have learned that really pretty much every patient buys off you because they trust you. This element of trust is so important to develop with your patient, because no matter how much you tell them, how long they have to think about all the facts and all the pros and cons and everything that you've spoken about with your treatment, if they're buying significant dentistry, then truly they're only buying on trust. It's incredible actually how many people have bought from me knowing so very little, and they let me do things with them in their mouths, and usually it's worked out okay for them. But really, we're taken up to the top of a very tall cliff, asking them to jump off with us, trust us that, when we hit that water at the bottom, it's going to feel great. So trust is really key. Now, to develop trust takes time. With our existing patients, if you've seen them every 6 months for say 3, 4, 5, 10, 20 years sometimes, then you've already spent that time with them. You're going to offer them something like Invisalign and they'll probably say yes. Not everyone, but that trust is already developed. But what about those new patients that you've got coming in who've never met you before? You spent a lot of money on marketing, and they're not going to buy from you unless they trust you. And building real trust with a patient can take a lot of time and effort. If you haven't got the time, then there's a very good chance that you're going to force yourself to just do a data dump on the patient, tell them 303 things that are wonderful about Invisalign and 404 things that could go wrong. And basically they're sitting there and there's no relationship building going on, and they're very likely not to proceed. You've wasted your marketing money, you've wasted your time. The way around this is to delegate. Delegate to a trusted, trained, competent, confident team member who can start that trust building relationship with the patient before you even see them. It's much cheaper, it's much more time for the patient and much better service for them, and you're far more likely to convert your marketing spend into actual case acceptance as well. It's so obvious, isn't it? It's common sense, but it ain't that common. Now, why is this? Well, when I look at practices around the country, they seem to think that TCOs grow on trees. The treatment coordinator can just pluck them out of the air, and there they go. They'll start off and they'll be perfect from day one or maybe day two. Well, TCOs don't grow on trees. TCOs need proper development. Often a TCO is a team member that you've had already. They may be a receptionist or a dental nurse. And it's a huge step for them to take on responsibility for a patient on their own. So they feel like there's a lot of risk involved. It's also the same for the dentist, of course, because to give up control of these initial appointments probably to a TCO is a big step for the dentist to take as well. And they feel an element of risk. Of course they do, because they're responsible for everything the TCO says and does or not does. So you can understand with that level of risk and anxiety about it that, dentists are naturally reluctant perhaps to go down this route, and dental nurses can be reluctant as well. But when I look around the UK and Ireland, I really see a lot of successful practices are really using the TCO system. They've got the TCO sorted out. The patients are coming in. The relationship building is going on. So when they finally meet the dentist, you know, the patient's already going to say yes. So what's the difference? Well, those practices have invested in their TCO training. That's the difference. There's a skills gap. They've recognized the skills gap and they've gone and filled that and developed their service. I have to say that whilst some practices have a TCO, you know, that TCO is sort of confined to booking appointments and maybe arranging finance. They don't really necessarily understand their role in consent and relationship building, but the really, really successful practices do. And that's certainly been my experience in my own practice as well. So what I've done is I've created this structured training program because I know how dental nurses learn. My master's is in clinical education. I've been training TCOs since 1986. I've worked out a lot of the bumps along the road, and I know they really like a structured training program, step by step by step by step. And they want support through that as well. So I've created this TCO blueprint training program. It's like an apprenticeship. So if you want to start your TCO service from scratch, then get involved with this. We'll do an audit with you. We will work out where the problems are, where the strengths are in your practice, and then we'll help you make a plan and guide you and the TCO through a structured training program, and then assess them at the end so they will know and you will know that they're competent at their job. We've got a variety of resources, blended learning going on. We can deliver it online, and we have one-to-one mentorship with this fantastic TCO trainer, Tracy Barnett. So if you think this might be a good idea for you, why not have a chat with Tracy, our lead TCO trainer? There's a link below. Just have a chat and start to find out what might be possible for you and your practice so you can deliver a really, really high quality, trusting patient relationship where more patients are going to say yes, pay your best fees, and recommend friends and family.